Well, good morning. May has arrived on the calendar. Let's hope we see more weather forecasts that sound like they might bring the promised May flowers. Well, there are some exciting healthcare developments in the future for Upper Michigan. This morning we'll talk with someone who helped lay the foundation for what the future will bring. It starts right now.
From TV6, this is The Ryan Report. Here's your host, Don Ryan.
Dr. Dan Mazzucchi has been an involved observer of the Upper Peninsula medical scene for about 45 years. He grew up in the Washington, D.C. area and spent all of his early years, including while in school on the East Coast. He moved to Marquette to begin a medical practice, became a leader in the healthcare industry, and has been an active member of the community ever since. Dr. Mazzucchi, welcome back to The Ryan Report.
Thank you, Don. Nice to be here.
You know, the last time you were here, we have to share this memory. 15 minutes before you got here, I got hit in the head with a large metal door.
I remember.
and I had a goose egg that actually looked like an egg.
Yeah.
And you and I sat on the couch for 15, 20 minutes wondering if I was going to be able to go forward.
I remember trying to figure out if you knew where you
Yes.
were.
And I apparently escaped having a concussion or anything like that, which
Indeed.
is such a concern today. You know, talking about your history, and we won't do a lot of it because we did that last time, but I never asked you, how did you happen to grow up in the Washington, D.C. area, other than the fact your parents lived there?
My dad was from Hartford, Connecticut, and had a sports athletic football scholarship and boxing scholarship to Catholic University.
Okay.
Moved down and met my mom, who was from a family that was part of the university system, and got a job, they got married, and he decided to spend his life there and raise his family, which that's what we did.
Okay. And also the fact that your coming to Marquette was not the result of a carefully thought out plan, was it?
It sure wasn't. As people ask, and sometimes I honestly tell them, I don't know how I got here. I was looking for a place, a perfect place. Of course, I discovered after a while there wasn't any such thing, but the right place, let's say, for raising a family. My wife Connie and I had 7 children. The oldest was 9. And so schools meant a lot. We thought about New England a lot. We were looking for places. I read the New England Journal of Medicine and saw an ad in there for a person who did what I did. I got on a plane and flew out here. I fell in love instantly with it. I told my wife on the phone, I think this is the place. She, in her trusting way, said, buy a house.
Really?
She had never seen the place. And we bought a house, and we're still in it.
And you and your family have become so involved in the community. You're a former mayor. You and your wife have both been very involved, and your daughter's a circuit court judge. I mean, you've really adopted this area, haven't you? This is your home.
It's home.
Yeah.
Yeah.
And
We don't want to be anyplace else. This is where we're going to be.
You know, today what I'd like to do is talk a little bit about the present and the past, you know, the history. But let's just talk, you know, I think we're at a point in time with this development of a new hospital in Marquette where we're really in the beginning of a new era of healthcare in this area. Would you agree?
I think so. You know, the fact that we have a new hospital is an astounding development, and a really happy development. Not that there aren't challenges, there always will be. But that's a $300+ million investment, not only in the community, but in the healthcare community, to be specific. At a time when communities like ours are facing the dreaded closure of hospital institutions and the loss of personnel. As I say, this isn't magic. It isn't something that's going to cure everything, and it isn't yesterday. It isn't going to be like it was yesterday. But it is positive, filled with hope in my view, and I think a continued attraction to this area, which for those of us who have been around for a while, we can see it continue to change and grow in many ways. And so that's really the best I can think of it as, a real opportunity for not only growth and development, but for the stability of the healthcare system.
And 2 key points to really emphasize that you brought out. This is not happening in healthcare across the country. This is a very unique situation.
It is indeed.
For this kind of investment in a small community, and we are a small community.
We are a community of 20,000. We're in an ideal location in that there's no bigger community for a couple hundred miles in any direction, but still we're a small place. We're gifted with a whole lot of things. Nature has blessed us in many ways. The university has blessed us. The job market is still healthy. And the growth, the continued growth and development of the healthcare industry is one of the really main factors in the stability of this place.
Kind of the point I'd like to make this morning, and I'll tell our audience what I told you, it's going to be kind of an executive summary because you could kind of write a book on how this all happened.
Yeah.
But in a sense, you arrived here at maybe a watershed moment is too dramatic, but at a very key time when this was all developing. And it began kind of with the fact that a merger was just occurring, right?
Yeah, I mean, a bunch of us did. There was a stable environment here for a long time, and then all of a sudden, a little growth spurt with people like me coming out of residencies and fellowships from other places being attracted here for one way or another. My family and I came here in 1973, and at that time, there were still 2 hospitals, St. Mary's and St. Luke's. However, the decision to merge had been made.
Okay.
And so that was in the process of developing. Marquette General was being formed. The closure of the 2 hospitals for a while was a difficult thing, just like so many things in medicine here have been difficult for the community. Both of the community hospitals had patrons that were dedicated to its survival and families have been involved with those institutions for years. They had to come together. Wasn't easy, but they did. Marquette General was formed. And from that start, a whole lot of things then proceeded without it. I don't know how they could have.
And that wasn't a magic moment, was it? Was it a matter of great optimism or somewhat survival in the beginning?
It was, for many of the people involved, it was survival. For those of us who were young coming in and seeing one place, and then at the same time seeing a place like the new medical center that Dr. Wright and his colleagues had put together, which was a home for all of us, an office home, it started to look like something very real and very attractive.
Okay, we'll pick it up right there when we come back. I'll be back with more with Dr. Mizuki after we take this 2-minute break. We're talking this morning with Dr. Dan Mizuki. We were talking about some of the early developments. You also arrived here kind of at a time when specialization was really expanding, didn't you?
It was brand new. I mean, the Marquette community, medical community, has always had specialties. And they've had, long before we came here, there were people in ophthalmology and OBGYN and even some of even orthopedic surgery and such. But there weren't very many. But the major development at that time was the beginning, the onset of medical subspecialties. So in the old days, internists were consultants and primary care providers. But they didn't specialize in things like cardiology or pulmonary disease or gastroenterology or renal disease. So as those things became real and available, the demand for them increased. And especially as not only the science of the stuff became more clear and usable, but as they developed procedures that related. So imagine cardiology without any procedures.
Right, yes.
There wasn't until they could safely do the procedures that we take for granted with a ho-hum, sticking tubes in there and getting pictures and replacing valves and all that. Nobody could do any of those things. But as those procedures developed, then more and more were needed. And so that really fed some of the growth.
And that was part of what the Marquette Medical Dental Center, which became the Peninsula Medical Center, brought to the area.
Absolutely. It not only was, they were the ones really who were spearheading the recruitment of people. Right. In those days, the hospital's job was to recruit hospital-based physicians. So the anesthesiologists and the pathologists and the radiologists, they weren't all hospital employees, but those were recruited by the hospital either through hire or through contracts or whatever. And the medical staff was given the responsibility of doing everything else, which I was amazed at how many people gave up their time and energy and stuff to go out and try to attract more people to help them. I mean, the population of this place hasn't changed since then, but there were only 30 some odd docs here when I came here.
Well, and I read in the history of the medical center, they started with 18.
Yeah?
And now I'm not sure, there are several hundred.
Yeah, I don't know what the numbers are anymore, but a couple of hundred would be a decent guess in terms of the county-wide population of docs.
One of the other things that helped to lay this foundation for where we are today is the UP Medical Education Program. Tell us about that.
Yeah, I'm really, really happy with that and proud of what's happened with it. I mean, it was a thought, an idea on the part of many. And of course, without Michigan State University, that really couldn't have happened. But the medical school, the MD Medical School at Michigan State. The dean then was convinced that something ought to be done about rural health and that at least part of medical education ought to take place in communities. And this was a fairly novel idea back at the time. So to establish a branch campus like all the other branch campuses of the university, of the MD Medical School at Michigan State, to have established one here in the UP, ooh, that was a real big idea, a new thing. And it was risky. The family practice residency program was a joint decision by so many of us at all specialties who looked at the need for primary care and thought this kind of place could train family docs very well. These programs now have been here, believe it or not, for almost 40 years. And it's become, if you'll pardon the term, a doctor factory for the Upper Peninsula. I mean, 30% or so of all of the graduates of each of these two programs became docs in the UP and are currently practicing here. And I don't know what we'd do without them.
Right, right. And you really devoted a big part of your career to this. I believe you took over the leadership in 1978, perhaps?
Something like that, yeah. The residency was my biggest initial concern in getting that off the ground, and then I ultimately became an assistant dean for the medical school here.
And as you said, is it still going strong? Does it have a strong future?
Stronger than ever.
Okay.
It's doubled in size since I left. The people who took my place have done marvelous jobs in both programs. They've raised the expectations of the programs, not lowered them.
Okay. I've got some more questions for you. We'll get to those in just a couple of minutes. Back with more on the Ryan Report 2 minutes from now. We're talking with Dr. Dan Mizuki this morning. We're really talking about where we are today and kind of how we got here. And this kind of goes full circle now. We're back to Marquette General Hospital. When you got here, they were just beginning the merger. It was more a matter of survival.
Yeah.
When do you think the light bulb went on and some of the leadership there began to see that there could be a major role for Marquette General in the future? Did that take some time?
Yeah, it took some time. I think it took some time for all of us to understand exactly where we were going. Not all of us thought in exactly the same way. We were under a lot of pressure from the needs of the local community, and the idea for some of us who were already hard-pressed to be involved in taking care of people from outside the community as well was a little difficult to understand. It also was something that pushed a little bit in terms of our willingness to recruit other people. And the development of those services became more attractive then to other people who saw themselves not only as primary care providers, but as consultants, given their specialty field. So, a while.
And at some point, some of the key leaders of Marquette General must have seen that there was an opportunity to become a tertiary care hospital and for Marquette to become a regional medical center.
Yeah, I remember once a group of surgeons, I think, from, I think Dr. Bennett was part of it, Matthew Bennett, but maybe some others too, brought people from Mayo Clinic, where they had trained down here, to talk to them about putting in a coronary care unit, because we didn't have one at the time. It was, an eye-opening thing for not just the people at Marquette General, but actually for all of us in practice as well, to begin to see what already was happening and what might happen in the future.
And really that is so important, because Marquette General went on to develop not just coronary care, but I think cancer care, orthopedics, some
Yeah, look at that center that's over there
right,
on Washington Street.
I mean,
Right.
so many of these things that, these foundations were put in place over the years.
They were, and it's, the number one, as I say, the number one reason is the people. People involved, not only hardworking, but in their own way, willing to look both forward rather than just backwards. Look forward and to look at risk and to be willing to assume it, to help to support some of the new people coming in. I don't think any of us really understood where this was going to go, but we believed in the future. And, I can't help it, it's a habit. I still do. I do believe in the future, even though it's not exactly like it was back in the good old days, as they say.
And I interviewed Bill Nemechek when MGH opened the Level 2 Trauma Center. And, it sounded good, but I thought, well,
Yeah.
this is just kind of a fancy emergency room. And then not long later, my son had an accident and wound up going there, and a neurosurgeon was there when he was needed.
Yeah.
On a weekend, on a Sunday afternoon.
Yeah.
And I can recall the days when if you needed a doctor on a weekend of any type, you probably couldn't find one.
It's true, and there were no beepers. There was no way to find people back then. People did the best they could, but there were severe limits. And now the hospital is full of people, not only emergency room physicians, but the hospitalists themselves who are in tending the needs of people who are already hospitalized as patients at Marquette General. They become specialists in the care of those kinds of circumstances. And I mean, it's a way more complete healthcare environment than ever it used to be.
I want to talk about one more thing before we go, and that is Trillium House.
Oh,
the last time you were here, you were just toward the end of a major fundraising campaign. Now the Trillium House is there. You must feel good about that.
I can't tell you how good all of us feel who are involved in it. We're closing in, not quite, but closing in on the first year of operation. We have seen so many wonderful things there. Families together at a very difficult time in life when a loved one is dying. One day a family came and said, my mom is close to death and it's Thanksgiving. Can we take over your kitchen? We said, sure. And they brought 20 family members in. They've cooked their Thanksgiving dinner there. They were able to spend all that time together. And the wonderful woman passed on a couple of days later. But and then another thing, after a man came with his wife who died shortly, he came to the leadership of the place and said, this is a nice place, but there's one thing you don't have. And he said, well, what's that? And he said, a grill. And he went out and bought this beautiful grill, which was used by families together through the summer. Can't use it in the snow, but on the outside patio. It was just wonderful to see. So ironically, at times, even though the place is a hospice house and the people in it are not doing well, there are times there of real, honest family joy. And when you see it, it really makes your heart swell. It's nice.
We only have a few seconds left, but again, just so people understand, this is not a nursing home.
No.
This is a hospice home.
This is a hospice home. This is a home for people in hospice care when their own home isn't the right place for them to be. Sometimes that's unstraightforward until they die. Sometimes it's just because the people who are caring for them need a rest. So we call that respite. So it's respite care too.
Okay. Thanks for coming in this morning and sharing these stories with us.
It was
Appreciate
fun.
it very
Thank
much.
you.
Okay.
Bye-bye.
I'll be back with some different thoughts for you in just a couple of minutes. With changes in our culture and the growth of technology, so many things are different than they used to be. As a result, there are a lot of things we used to say that we rarely, if ever, say anymore. For some of you, this will be a reminder of how it was when you were younger. And for those who may be too young to remember some of these things from the past, it's a lesson on how it used to be. Things like, I wish I had my camera. I'd love to get a picture of this. Cameras have become almost a thing of the past. With the arrival of the smartphone, we always have a camera in our pocket. Or, I had to pay an extra charge for not rewinding the videotape when I returned the movie to Blockbuster. There's a lot about that that's outdated. Or how about, I'm not feeling well. Could the doctor make a house call? That was true in my lifetime, but it was a long time ago. Here are some other random thoughts that have pretty much disappeared from life today. Things like, I think I'll go to the grocery store. Oh, that's right, they're all closed on Sundays. Now it seems like some never close. And remember in the pre-cell phone days saying, I can't leave home right now, I'm waiting for a phone call. How about everywhere I go, I see the time blinking on the VCR clock. We haven't seen that in a long time. And speaking of time, I wonder what time it is. I think I'll call the telephone time lady. Are you buying a new car? You probably don't have to ask anymore if it comes with a radio or automatic transmission. And do you remember saying, I need some lumber at the building supply store, but it was Saturday and they all closed at noon? When's the last time you called the coal supply company and asked them to send over a couple of tons to get you through the winter? There probably aren't many of you who ever did that, but my grandparents did. That kind of falls in the same category of buying ice for the icebox. And how many times did we all use this one? I'm going to wait until this weekend to call my friends out of state. The long distance rates are lower then. Have you said to a friend lately, I want to go to the movies, and while there I'm going to have popcorn and pop. Will $5 be enough? Or how about, I'm wondering about the weather forecast, but the only time and place I can get it is on TV6 on the early or late news. Nowadays it seems you can't get away from weather forecasts. One thing we know for certain, change never stops. If we did this again 10 years from now, there would be a lot more we could add to the list. Things like, I think I'll drive my car to town. Oh, that's right, I don't drive the car anymore. The car drives me. I'll be back in a minute. Time to wrap it up for another week. The Today Show will be here in just a moment. Remember to keep Upper Michigan's Source.com in mind for the latest news anytime and for a rebroadcast of this show each week. Today's show will be here starting tomorrow afternoon. Past episodes are available now. Thanks to Dr. Dan Mizuki for joining us today for an interesting perspective on healthcare through the years. And thank you for joining us. Hope you can be here again next Sunday morning.